Latanoprost is a medication that reduces pressure in your eye. It is a prostaglandin type F analog. It is well known with its brand, XALATAN, and it is available as eye drops. In a few people, pressure in the eye is elevated. This pressure is measured as intraocular pressure, termed IOP. Normally, this IOP falls between 10 and 21 millimeters of mercury. However, in people with glaucoma, this IOP may be elevated above 21 millimeters, and it causes pain in the eye. In such conditions, latanoprost eye drops can be used to reduce intraocular pressure. You may also be given latanoprost for reducing ocular hypertension. This is again associated with elevated pressure in the eye. Latanoprost helps reducing this pressure. In this video, we will explore key facts about latanoprost, like how it works in reducing intraocular pressure, what is its effect on the eye, what are common side effects, how to use these eye drops, and what are the important precautions. How it works. Latanoprost works by reducing intraocular pressure in your eye. Normally, cells in the ciliary epithelium in your eye secrete a water-like fluid called aqueous humor. It maintains the right pressure in the eye. It also supplies few nutrients. It can flow easily in and out of the eye due to its water-like structure. It is drained out of the eye through a small canal-like structure. However, in people with glaucoma, this drainage is either insufficient or blocked. This results in the buildup of pressure in the eye. Such people may experience pain in the eye and blurred vision. They may notice blind spots and halos in vision. It should be immediately treated, otherwise it may lead to loss of vision. Latanoprost eye drops can be used in such people. It is a prostaglandin F2 analog. Therefore, it acts on prostaglandin FP receptors as an agonist. This results in increased drainage of aqueous humor. This reduces pressure in the eye and relieves symptoms of glaucoma. Ocular hypertension is another condition linked with increased pressure in the eye. It is again due to the buildup of fluids in the eye, and if left untreated, it may lead to the development of glaucoma. Latanoprost can also reduce ocular hypertension by increasing the drainage of aqueous humor. How to use this medication? Latanoprost comes as eye drops. It is available in two forms. One is the multi-dose eye drops intended for repeated use. This ophthalmic solution contains a preservative, benzoyl chloride, to maintain the product sterile. However, on long-term use, preservatives may cause either allergic or adverse reactions. This limitation can be eliminated by recently FDA-approved preservative-free eye drops. These are intended for single use, therefore free of added preservatives. This pack contains a certain number of single-dose containers, each for single use. Both types of ophthalmic solutions differ only in the presence of a preservative. Dose and time of administration are the same for both of them. These solutions contain the same medication, latanoprost, at a strength of 0.005%. Therefore, each ml of this solution contains 50 micrograms of latanoprost. However, you need a single drop of latanoprost ophthalmic solution instilled into the eye once daily. Each drop delivers approximately 1.5 micrograms of latanoprost into your eye. Don't use more than the recommended dose or even combine other prostaglandin eye drops. Using at higher doses may cause a reversal effect, and it can raise your IOP. However, you can use other ophthalmic solutions other than prostaglandins along with latanoprost. In such a case, at least a 5-minute gap should be given between two eye drops. You should use these eye drops in the evening, as they work better at reducing pressure in the eye during the night. Reduction in intraocular pressure can be observed within 3 to 4 hours. If you are using contact lenses, remove them before using latanoprost. You can put on your contact lenses after 15 minutes. Macular edema. Latanoprost can induce a condition called macular edema. It is due to dilation and increased permeability of blood vessels supplying the macula, leading to its swelling. This may distort your vision. Latanoprost can further increase this risk in people with pre-existing macular edema. Therefore, in such people, latanoprost should be used cautiously. Use of latanoprost can worsen inflammation in the iris and uvea. Therefore, check for any existing intraocular inflammation before use. If you have any previous history of eye infection caused by the herpes simplex virus, you should use latanoprost carefully. This virus may cause inflammation of the cornea, resulting in herpes keratitis. Upon treatment with antiviral agents, this virus may be inactivated. However, in such people, Use of latanoprost can reactivate this virus, leading to enhanced inflammation. If you have contact lenses, don't forget to remove them before administration of latanoprost eye drops. You can reinsert contact lenses 15 minutes after instilling these eye drops. Side effects. You may have redness, swelling, and pain of the eyelids. Sometimes, latanoprost can also induce tears. Latanoprost can cause pigmentation on the iris, which may remain after its use. It can increase the melanin content in the iris, which can lead to a brownish coloration. This medication can increase the length of your eyelashes, and it can even increase their thickness and number. Latanoprost can stimulate the growth of hair cycles that lead to eyelash growth. However, this effect slowly disappears on discontinuation of latanoprost. You can observe a few local reactions with the administration of latanoprost into your eye. These are common and mild in many people. Latanoprost eye drops can produce stinging and burning in your eyes. You may feel like foreign bodies are present in your eye that cause itching. However, these side effects are observed with early doses. On continuous use, you may not experience such local reactions. In a few people, latanoprost can cause blurring of vision. It can also show a few systemic side effects. You may have flu-like symptoms. It can also produce muscle and joint pains in a few people. These are the important things about latanoprost. That's all, guys. Thanks for watching this video. Have a great day.